Yes, Clover Hospital is about healthcare delivery, and it cuts across all classes of people. We see patients with ordinary malaria fever, pneumonia, general medical cases. We also have cardiology cases, we have echo machines, we have ECG, we take care of diabetes, and we also see people that need endoscopy, people that have upper GIT issues. We have gastroenterologists visiting. We also do perform surgeries, appendectomies, lumpectomies, intestinal obstruction, depending on what you present with, thyroidectomies and all that. We have pediatric services, we see children, we see newborn from outside, we also have our inborn, we have newborn units, we have incubators, ventilators, CPAPs, depending on what the pediatrician decides to use. So on the last floor, because we're on 4 floors, we see women with infertility. Infertility is quite crucial. Men and women, because male infertility is also a problem as well as infertility. So we deal with simple conditions like about fibroids, polyps, and other gynecological issues. We do in vitro fertilization here, that is those who have the need for it, women with blood tubes, men with low sperm count, so to say, and other issues with their sperms. What we do is to, it's like getting the sperms to fertilize the eggs artificially, and then putting back into the woman. At the end of the day, the child will also be born like other children. It's a service that the need cannot be emphasized. We also take care of older women, people that are like 40, 39, that need to check if their eggs are, they're not going to bring forth children with chromosomal abnormalities, so we do genetic studies. And if there are other advantages of genetic studies, they take advantage of that as well. So I must say that the services that are available here are offered to general public as swiftly and in the most professional manner. We also counsel a lot of patients on immunization, and we see HIV patients as well, other conditions, because you don't know when a patient walks in what it has come with. So for some specialties, we don't have the ability to work on or treat. We send to friends, the hospitals, so to say, and the government hospitals as well. So I must say that where we are here in BCA, we offer services with immediate neighbors and other referrals coming as well. So we are happy to be one of the institutions that are doing this. So it's a hospital with a specialty, but most at least major specialties. The consultants come in and do their bits and go. So you don't have one person treats all, like obtains in some parts of the suburb, maybe Abuja, where you have an ailment and the doctor or the health provider keeps you down because you must treat. Here, we don't do what you are not supposed to do. You don't treat what you are not supposed to treat. you get your colleagues who are specialists in those fields to take care of the patients as they come in. So Clover Hospital is where to one of the places to be, not just where to be, one of the places you can come and you are given the right diagnosis, you are given the right treatment, and we escalate when we cannot do anything about it. So that's brief. Clover Hospital, we are located on Kano 11 Agadez Crescent. We are open 24 hours. We don't talk about equipment because if you don't have equipment, it won't function. But I just mentioned a few. Upstairs here in fertility units, we have scan machines, we have IVF equipment, we have EC machine, we have incubators, we have DWAs, we have theaters specific for IVF, and we have a new genetic unit with the sequencing machines for what I said earlier. Then downstairs we have 2 labor wards that are fully equipped with CTG machines, suction machines, and delivery tables. We also have our NICU, as I mentioned earlier. There are major theaters. We have endoscopy theater where we do hysteroscopy and laparoscopic myomectomy, cholecystectomy, appendicectomy, and other specialties. We also have the general theater where cesarean sections and appendectomies can be done. And then the endoscopy room where we have the upper GI equipment and the lower GI. And we have our lab where we analyze samples. We have a blood bank as well, pharmacy, and an X-ray machine, echo machine T19, software cardiac treadmill. So, in summary, we're just a hospital that can give these services in the most appropriate manner. Thank you.